Hello, my name is Dr. Anne Amate and I am a physician at KS Hospital. I would like to speak to you about the hepatitis viruses. Hepatitis is an inflammation of the liver. There are 5 hepatitis viruses: hepatitis A, B, C, and hepatitis D and E. Hepatitis A is usually transmitted when we ingest or when we take in food or water that has been contaminated by fecal matter of somebody who has had previous hepatitis A infection. It can cause very severe symptoms, but thankfully when you come to hospital, we can treat you and support your liver and you get better, and usually you have no complications thereafter. Hepatitis B, on the other hand, rarely has any symptoms when it is in the acute phase. So if somebody comes to hospital, more likely when they have symptoms, they also have a chronic infection. But sometimes they actually may not have any symptoms. Hepatitis B is transmitted through bodily fluids. So you get hepatitis B from somebody else who you have come in contact with who had hepatitis B, through their blood, through their saliva, through their fluid, sexual fluids, usually semen or vaginal fluids. So hepatitis B can be treated, but it can also lead to complications of the liver, and sometimes it can lead to liver cancer. Hepatitis C, on the other hand, does also not have very many symptoms in its acute phase, but it can come with complications to the liver, and it can also come with liver cancer. Hepatitis C has treatment, and usually one may recover from hepatitis C and hopefully prevent the complications of hepatitis C. Hepatitis D is not very common and usually also does not cause severe symptoms, and neither does hepatitis E. However, for a pregnant mother, it can cause very severe disease. It can cause the mom to lose her baby before the baby is born, and sometimes it can cause the death of the mother herself. So with pregnant women, we usually want to be very careful. With hepatitis E as well, it can be transmitted by poor hygiene, so it is transmitted from contamination of food and water from the same fecal matter from somebody who has hepatitis E. How do we prevent the hepatitis viruses? For hepatitis A and for hepatitis E, good hand hygiene is very important, and so is good food hygiene. Hepatitis A also has a vaccine. Hepatitis B has a vaccine, and we encourage health workers and people who work with patients to have hepatitis B vaccination, and even to the general population. In fact, Uganda has been vaccinating babies since 2002 against hepatitis B. Hepatitis C, unfortunately, does not have a vaccine, neither does hepatitis D, and neither does hepatitis E. We'd like to encourage you to come in and have a hepatitis B test, and if found negative, get vaccinated against the hepatitis B virus. See you here. Don't wait. The time is now.